Good morning, everyone. This is Morning Sign In by Morning Sign Out here at UCLA, and you are listening to UCLA Radio. So, this is the show where we break down healthcare topics in ways that are a little more digestible than, I guess, your research articles that you find online. And just a quick reminder before we step into today's episode, we are not medical professionals, and we just want to talk about things to make them more digestible again. And if anything about today's show resonates with you, the next best step is to talk to a professional. So today's episode is going to be AI and its misuse in healthcare. So I guess as a hook, like how would you feel? Oh wait, sorry, this is Laura, by the way.
This is Nicole.
Um, Great, thank you for being here with us today.
Of course.
So as a hook for today's show, how would you feel if you knew that AI was being used to, I guess, make your medical decisions?
I feel like it's very 50-50 with me especially because like if I'm using AI to like make health decision, I'm not fully like educated on the topic, but I feel like if someone with a medical degree, they can quickly tell that like, oh, this is incorrect. And I do feel like it can be helpful or harmful if the proper software is used, because a lot of times like if a doctor is using ChatGPT or a person's using ChatGPT, there's no like wall between your information getting sold or your information getting in the wrong hand, if that makes sense.
That's true. Definitely a lot to think about in that sense.
Yeah.
So I guess to like start us off, what does AI in healthcare already look like? Are they already using it?
They can use it to like assist with diagnosis, especially if your symptoms are very like we don't know, and they use it to do clinical support decisions, medical report generations, which are very interesting, patient-facing chatbots, wow, hospital management, medical education, medical management. So before we even talk about what can go wrong, it's important to understand how many parts of healthcare AI is starting to touch.
I think it is important to touch on, the breakthroughs AI has made, but I feel like, this technology is advancing so quickly. So I guess one major breakthrough, I found this article, it's that DeepMind's AlphaFold is an AI system that predicts like the structure of nearly every protein known to science. And so understanding these protein structures is really like good for drug development, and researchers believe that this tool could really accelerate, I guess, the discovery of new medications.
Wow.
Which is really cool, definitely. And AI is also being used to predict dangerous medical events. So some hospitals are using, I guess, machine learning systems to estimate whether surgical patients are at risk for complications like septic shock or like respiratory failure in the weeks after surgery.
That reminds me of the Aura ring that people like keep on their hand all
Oh
the
my
time
gosh.
that can like track your
Yeah.
medical stuff.
Yeah,
That's really
that's
interesting.
from Finland. Plug, yeah, that's from Finland. I think it's really interesting to see how these can track, I guess, all of your data.
Yeah, some girl, like a lot of people be like, oh, my Aura ring told me I was pregnant before I even knew, and I'm just like,
What?
whoa.
Oh my gosh, that is kind of crazy. Another example I found in this NCSL article was that in pediatric medicine, researchers are even creating AI-generated digital twins of infants using data like gut microbiome and predicting possible like neurodevelopment issues early in life.
Wow.
Yeah, I thought that was interesting. I was like, I don't know how they're doing that. And we had an episode about gut microbiome, so I was like, it is interesting to see what you can do with that kind of information. Like, you
Yeah.
can recreate a human.
Yes, I seen a reel of them like putting a dead fly's mind into like a video game, and the fly was doing everything that it would normally do if it was like actually alive.
Wait,
So serious.
how did they do that?
I don't know. But it was like on a game. And it was like actual
Huh.
scientists in an actual like lab and stuff like that.
Oh, wow. That's crazy. I wonder how they got that data. But yeah, these are some of the examples that kind of show why many doctors are kind of excited about AI as one of the most, I guess, powerful tools in modern technology. But this technology also like raises a lot of serious concerns about safety,
Yes.
bias, privacy.
Yes.
Like, this is all developing so much faster than even policy can keep up with, is another thing. Like,
Yes. Yes.
Yeah.
There has been like a lot of cases of people like misusing AI, and since the law hasn't caught up to it, there's really
Mhm.
no laws to put in place to be like,
Right.
oh, this is like wrong, or oh, this is correct. So we're gonna
Right.
talk about algorithm algorithmic bias, especially within the healthcare aspect, but also like AI has shown algorithmic bias towards like black people, all POC, like especially grouping them together. So I definitely feel like that can like pour out into the medical field, especially because there's differences in race, housing status, gender identity, and income. So all these things kind of like compile together because AI has already shown bias towards certain groups of people, and that's like obviously not okay.
Right.
Because like doctors do have like their internal biases, but I feel like AI biases can be extremely more harmful because they have access to the full internet and can make like really big generalizations based upon one thing, especially if your AI like ChatGPT, you can like go in and like basically make it say what you want, like, oh, never disagree with me or something like that. So it feels like you're correct when you always have someone like reinforcing your ideas and being like, yes, 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 even though it's not like a physical person there saying, oh, yes, you're correct, or oh, no, you're wrong.
Right. No, definitely. And I think that, well, I saw this article on renal and urology news, and it was basically talking about how some of these biases show up. And it showed that, like they could have patients of different socioeconomic incomes, and it would suggest different treatment plans for different people just based on that data, which is very questionable.
I feel like it is very questionable, but also it tracks very truly because people from different socioeconomical status, they don't have the same resources as everyone else. Like say a lower class family might only have like not good food, like food desert, and like a higher class family would have like a lot of places to go get food. Like you can tell, especially here in LA, like if you go into the lower income neighborhoods, you only see like liquor stores, no actual like grocery stores. But if you go into like higher income area like Westwood here, you see Ralph's, Trader Joe's, Target, all these different places to buy food. So I definitely feel like it's
true.
not okay, but there also might be a reason behind why the AI is like, oh, maybe they can't get these specific resources.
But I feel like
not to defend AI.
I feel like offering all resources up front is for the best. Though.
Yeah,
that way
definitely.
The person can make the decision.
The decision on their own. Yeah.
That way, a person doesn't have to immediately take like a suboptimal treatment plan.
That is true.
But I guess based off of this, like if AI systems can learn from biased historical data, is it helping doctors make better decisions, or is it hindering them?
I feel like it's definitely helping and hindering because also, I feel like this also plays into a bigger like picture of doctors being very overworked and underpaid to so they feel the need that they need to diagnose this person without fully like putting their all into care. Not to say that doctors don't do that, but it's very common for doctors to feel overworked, like they have a very high patient load. So maybe this is why like they're feeling comfortable, more comfortable using AI because they're like, oh, AI already knows everything, quote unquote everything. So I can just use it as like a crutch to like help me. But also like you can do peer reviews and like have your other doctor who actually has a medical degree like be like, oh, what do you think the prognosis is for this case? You could work together instead of helping AI get better because AI is literally destroying our world and drinking up all our water.
Yeah, I think because don't doctors go to school for like 12 years or something like that?
The pre-med route is really, really long.
Yeah, it sounds really tedious, and so it's kind of sad that these we see this over-reliance on AI, and I think it's because AI has the ability to take such large amounts of data, like so much data, and come to conclusions a lot faster sometimes than humans can.
Yeah.
And it's very interesting to see, but it's important to acknowledge that AI oversteps sometimes and misses things, for sure. Misses a lot of things. And so I can see why, like, a doctor might feel, more inclined to believe in AI over their own gut just because, I don't know. What do you think?
I feel like gut feeling's never wrong.
Yeah. I feel like if you get that gut feeling, it's like over.
And like the AI doesn't have like a medical degree. I feel like in this specific case of like doctors using AI, there needs to be like a specific AI that doctors use that has the safeguards in place, not selling your data, complies with HIPAA, and the patient can see after, just to make sure there's no like bias going on with the doctor or with the AI. I feel like that is a better option.
Yeah. I think that most hospitals using AI have their own machine learning tools and their own AI systems. But it is a question of, the privacy of these systems and how secure are they. Also, accountability is a big question as well because, if something goes wrong,
who do you blame?
Literally, who do you blame? Like, do you blame the chatbot or do you blame the doctor that sent in the question or used the tool that was provided? It's very, very difficult to say. AI, there's also been a history of misdiagnosis with AI for sure. So there's this thing I saw on a nature.com article. It's called hallucinations. So it's when an AI system generates information that sounds convincing, but is actually false and unsupported.
Yes.
Yeah. Like,
AI
they'll be
literally
so confident.
Make up whole documents and give it to you, and you follow the link, and it's like nothing there, and I'm like, this is not true at all.
No, it is very interesting to see. Like, they're so confident about it, and I think that I can see why people might be more susceptible to believing it because of that. And so, I don't know, recommending like a treatment plan based on non-existent evidence could kind of lead people down the wrong path. Yeah. And I think that this could be like very bad in the case of like rare diseases, especially like complex cases where you need so many different symptoms, I guess, to diagnose it. I think AI can be kind of harmful in the sense that AI will be very confident with the wrong answer or like just based on so little.
Yeah, they can also make up a study or mix up a study with someone who has similar conditions and one thing might be off. Like they don't have like I said, any safeguards, no medical experience. Like you can't train AI to have medical experience because they're not real. Like it's not a real thing, human or person.
Yeah. I wonder, like if the more that they use AI, the more it develops and becomes better.
Yeah.
And I think that is the case, but it's still like
I don't know.
I don't know.
Like AI can't even do basic chemistry. It's like I'll ask them to help me with my chemistry homework, and I'm like, even I know when I'm struggling, I'm like, this is not even correct. Sometimes like AI can't even do 2 + 2. So
that is true, but yeah. Well, we will take a little break now, and we will come back to talk more about AI.
Yes.
Thank you. Hi, everyone. We are back to talk about AI in healthcare.
Yes.
So I guess starting off where we sort of left off, the question of accountability. If something goes wrong when using AI in healthcare, who is to blame?
Yeah, who's liable?
Who is liable? Who is responsible when something goes wrong? And if an AI system gives bad advice, but a human signs off on it, like, I don't know. That's so murky.
Because, like, if a doctor messes up, like, their medical degree is on the line, not the AI. Like, you can easily get, like, unable to practice. I don't know what it's called for, like, doctors, but I know for lawyers, you get disbarred.
Really?
But, so, whatever the disbarred version of that is in medical terms.
Oh, man. And I feel like, I feel like doctors go wrong sometimes as well. But I think it does become a question, like, I can see it being easy to blame AI, like, oh, like, this technology failed me, Like, I can see it being equated to just using, like, a medical tool, like, oh, this machine failed.
Yes, but, like, you can blame the machine. Like, I understand, like, with, like, a knife or something like that. So there will always be someone to blame. But I feel like with that, like, you don't use the AI as a crutch. You use it to, like, help and guide you. You don't be like, oh, what is this person's symptoms? Give me a diagnosis. Give me a treatment plan. You're the doctor. You know all the information, and you know the patient's history. The AI does not know the patient's history unless you upload their whole entire, like, patient history and notes to the AI, which is extremely dangerous.
What if they do that?
I feel like that's a HIPAA violation.
It might be. That is true.
Like, I know they have been using AI in healthcare for a long time to, like, help make things more manageable, and I'm not talking about that. I'm talking about them using it for, like, oh, diagnose this person. And when it's a doctor losing their license, it's called license revocation.
Interesting. That is definitely something to think about. And I think, well, I saw that, I was on ChatGPT, like, a while ago, and I saw that they had, like, a little thing like, oh, don't put any sensitive files.
Yeah, don't put any sensitive files in here. Like, it literally says Google Gemini can be wrong sometimes. Please fact check your information. So
Yeah.
I wouldn't trust it to like put, I don't know, and like there you can, AI doesn't have human connection, so sometimes you can just tell when someone's like not doing well, even if they say they are doing well. Cause like
Hmm.
on paper things are completely different in person, and I feel like those type of situations can be like misinterpreted very very drastically.
That is true. I do think that doctors need to see a lot of body language stuff that AI cannot do.
Yeah.
And so it does become a question of how is this tool being used in healthcare and how can it be used responsibly, I guess. So I guess like going back to surveillance and data privacy, that is definitely a big concern because if that information gets leaked, like
You're done for.
very sensitive information, I wouldn't want that out in the world. Like if I was in the hospital, I wouldn't want like all my numbers out there. So I guess
And they can sell your information too.
really?
Yes.
Hmm.
It's like
It's
AI.
like who owns this patient data?
Exactly. Oh, but it says AI in healthcare must follow HIPAA if it handles, processes, stores, or transmits protected health information on behalf of a covered entity, so
Mm.
providers and insurance. But I still feel like, I don't know. I still feel like a little bit iffy, but it says compliance in AI healthcare, BAA requirements. AI vendors must sign a BAA ensuring that they protect patient data.
Hmm.
But still,
I guess that's good. Like I think
mm,
it definitely needs to be secure. I had written that, hospitals store this data and technology companies might analyze it and AI developers might use it to train their systems. I think that's one
yes.
thing. Like a lot of data gets used to train systems. I think that's the same. I'm just talking about like ChatGPT from my
Ooh.
own experience, but I know that there are a lot of different AI systems and a lot of machine learning systems that are being developed.
Yes, yes. In the legal setting, a BAA compliant AI, it provides a legal contract guaranteeing HIPAA. Like you have to adhere to HIPAA. No ifs,
Okay.
ands, or buts. But if you don't, like if you use ChatGPT, which doesn't have, you don't have you have liability. Like you're solely responsible
The
for fines up
person.
to $141 to $2.1 million.
Oh. Oh, so like a doctor using okay, so doctors basically can't use ChatGPT then.
They just need to make sure that it's like BAA
Oh, okay, okay.
compliant.
I see. I was like, dang, $2 million. I would not risk that.
Oh,
Um,
it's the Buy American Act.
okay. I think well that's good because I think if you put sensitive information into ChatGPT when it literally tells you not to do that, I think
Yeah,
that is, fair that they would find that amount. And I think hospitals have developed their own systems that comply with these laws,
yes,
which is good. It is good to see that these policies are being made surrounding AI and machine learning and everything
definitely.
artificial intelligence. Um, so I guess another question is like, can patients kind of meaningfully consent to these AI systems being used?
I feel like yes. When I was at the doctor's office a couple weeks ago, she was like,
Hmm.
"Oh, can I just like record the conversation with AI?" And I was like,
Really?
"Yeah," but
Oh,
I that was only one time, and it like recorded everything that I was saying, like everything, and
I
it
have
popped up
never heard that before.
on a transcript.
Oh, okay.
It popped up on a transcript, and I don't know like what platform did she use,
Yeah,
but
that's
a little bit iffy
very
still.
interesting. I wonder what she used it for.
It was just to do the notes and like remember what I said, but I also feel like
Okay.
you can also type notes right in front of me. There's better ways to do it. I
Yeah, and
definitely
I
feel
feel
like
like there's always voice to script as well, like to
that is true.
use, I don't know. I guess you can use AI for anything. Um, but I had written that, many patients might not realize that their medical information could be used to train or improve AI. Like it sounds like your doctor was really, I guess, transparent about that, which is
Yeah,
great, but I think even when like hospitals include consent language in policies or forms, it's kind of unclear whether patients really understand how their data is used and shared.
especially that's like really, really, really interesting. But also like I feel like if you are using AI to help a patient, they have that gap. They only know what you tell them, not like your CBC, ECG, any of that stuff.
Is
Which
that
is
just like past, I guess, information?
this is all like stuff from your blood. Like
Oh, yeah. I think yeah, that would take, like putting in that information into the AI as well.
yeah.
So I guess like going into regulation, it sounds like these policies are kind of catching up, but this technology is evolving so quickly. It kind of begs the question, can policy catch up in a meaningful way, or like are there going to be a lot of mistakes to be had, I guess. And I think mistakes happen with all sorts of technology, unfortunately.
And human error.
And
I feel like
human
with human
error.
error, it's like more explainable. AI, like I feel like people think AI is like all knowing and like get surprised when it makes mistakes.
Yeah, no, definitely. And these AI tools, they're influencing diagnoses, treatment decisions, and patient advice. And this just means that mistakes could have serious consequences, and agencies like are finally starting to develop new rules to like manage these risks,
Yes.
for sure. And so one thing I thought was interesting, I saw that New York has actually proposed a bill that would limit how AI chatbots provide professional advice.
Wow.
So under the proposal, companies that operate AI chatbots could face legal liability if their systems give medical, legal, or other professional advice that would normally require a licensed
Oh,
professional.
even this is for all.
I guess so.
Oh,
Yeah,
I thought it was only for MDs.
yeah, this is based on the hklaw.com article about the New York bill. But this is very interesting. So I guess like arguing both sides, supporters of this proposal argue that it protects patients by ensuring that professional medical advice comes from licensed experts rather than automated systems that, just learn from data. Yeah,
Because data can also be misconstrued and manipulated as well.
definitely. I think it's all kind of statistics. It's kind of crazy.
Mm-hmm.
And critics of this say that laws like this can be hard to enforce because it isn't always obvious when an AI chat box is actually giving medical advice. And it's also just unclear who should be responsible if that advice turns out harmful.
But they do also say do not upload information to here. Like take what Google Gemini, ChatGPT, whatever AI chatbot that you're using, take it with a grain of salt.
Yeah, that is true, but I guess it's I can see it becoming a little blurry if a patient is using it to like self-diagnose or something like that.
Yes. It says Gemini is AI and can make mistakes. And I said, I just uploaded it. Can I get medical advice? I cannot provide medical advice, diagnosis, or treatment recommendations.
Really?
I am an AI, not a doctor, and I don't have the ability to perform a physical exam or know your complete medical history. However, I can
Okay.
provide educational information to help you prepare for a conversation with a healthcare professional.
Okay, they thought of this. They
And it
thought of
says,
this.
when you seek immediate help, if you're experiencing chest pain, difficulty breathing, sudden confusion or loss of consciousness, severe bleeding, or injury.
Okay. Okay, that's good. Definitely good to have like a little blurb beforehand, but it makes
People
you
don't
want.
read that.
People don't read that. I would read that, but that is definitely a good warning to have before using these chatbots. Um, so I think that this is really interesting because it's like, how do you, I guess, encourage innovation while still protecting patients and like keeping safety on top of it all? AI I think has the potential to improve all of this. Like I think it, in the right hands, it can improve diagnosis and streamline healthcare systems and expand access to medical information. But
Yes.
without clear rules and accountability, the same technology kind of risks patient safety and privacy as well.
I definitely feel like that's the case because like their
Mhm.
AI is helping versus hurting, but I do feel like AI shouldn't be like accessed by the general public. Like you should have it under extreme strict protocol, and like not everyone should be able to use it. Like obviously everyone's able to use it now, and this is why you have people thinking that they're medical professionals, and they're like, well, ChatGPT told me this.
Mm. Yeah, I think it's very difficult just with how fast it's developing. Like we can't keep up with putting laws in place because I don't know. I think the law system just takes a really long
Yeah,
time too.
so
Like
long.
I, gosh, I remember that from my government class, but I think we just can't keep up with this rapidly evolving technology. Like something someone probably created like on a whim one day.
Yeah,
Well, I mean, machine learning has been around for like years and
decades.
years,
Yeah, but I feel
but
like it's not.
it's never been this widely used.
Yeah, And I feel like it was more like heavily protected, if that makes sense.
Yeah, it was definitely just a tool used by technology companies and like labs, everything. So it's very interesting to see, like when these modeled I guess sites hit the ground running with just general populations. It's very interesting to see how many people are using it and for what,
and what
are
they're
they
using it for.
Yeah, what are they using it for? Is it being used responsibly? No, not all the time.
And I feel like this ties back into a lack of people not having critical thinking skills in AI, like making our brains more mushy. Because a lot of the stuff I see people use AI for, I'm like, there's a website for that. And YouTube still exists, but everyone
YouTube
is
still
like so
exists.
addicted to their phones and like
Everyone wants a fast response.
exactly.
Yeah.
People are just so impatient. As an impatient person, yes, just want a fast
Yeah.
response. But like also like human connection, literally anything other than using ChatGPT. Like
Yeah.
Google exists, cool fun websites exist for that reason.
Yeah, I can understand. Like, I remember in high school I did a paper on emergency rooms and just how exhausting they are and how people spend hours and hours in these emergency rooms. And so it's kind of like, like if you can put in your lab results into an AI and have that sped up, I think it can be really good in the sense of just speeding up healthcare, like letting people get help. But that also goes back to the same question of bias. And I saw that in the same article. It was saying like it would have bias towards, who should get health care faster.
Mm-hmm.
And that is another problem, yet another problem with all of this. But I can definitely see how, there are benefits to AI, like, and I've seen a lot of horror stories with like self-diagnosis and people kind of
going into psychosis because ChatGPT was egging them on,
glazing them, definitely. But I guess like some benefits, like if I had to play the devil's advocate right here, it's accessible. It provides 24/7 access to information. But there's also nurse hotlines. I would say that. Like
there's always
nurse hotlines all the time.
Hotlines.
Accessibility, it is 24/7, which is nice. There's triage support, so it helps determine if symptoms might require emergency. But, obviously, with a grain of salt, I don't know. Health literacy, patients can learn about different conditions, although I think a Google search can do that as well.
This like whole people using AI to like self-diagnose reminds me of when you like Google your symptoms and they're like you're supposed to be dead 5 minutes ago.
Yeah, I literally think that this isn't anything new.
Yeah.
A little bit. Like self-diagnosing using just the internet in general. Like I think that it's very easy to think that your symptoms are fatal just by like Google searching, because that was like, dude, I was so scared the other day because I ran out of contact lenses and I was wearing like the same contacts for like a week straight, which is really bad. But I like Googled it and it was like, you're gonna get like an eye infection and your like eyes are gonna
lose your eye.
Like your eyes are gonna fall out and like you're gonna develop this weird rare infection. And I was just like, oh my god, I'm gonna die. So, take with that what you will, I guess. I guess like risks with AI.
Yes. They're not very accurate.
Mm-hmm.
The studies indicate poor diagnostic accuracy between 19 to 37.9%, often leading to misinterpretation. Wow, that is a lot. That's a big chunk.
37, that's like a
imagine
third.
losing 37% of your hair. That's a good way to put it in perspective.
That's awful.
And psychological stress. An over-reliance on AI or hypochondria can cause...
Cyberchondria. I haven't heard that word.
Oh, because it's like hypochondria, but like...
But you're like... Cyber. That's a good word. I like that.
It could cause unnecessary fear, anxiety, and self-stigma. And, as we were saying beforehand, a lack of context.
Yeah.
AI tools lack the ability to perform physical exams or access a person's personal medical history. As Google Gemini just said, like, I can't help you. I can't give you a physical examination. I don't have access to your medical records, which is good.
No, it's all based on just what a person says.
Yeah.
Which can be, different from the real life scenario. I think it's very helpful, and like in-person doctors can actually see how you're doing, see the eye bags under your eyes and whatever symptoms you might be showing. Like, I don't think AI gets the full picture.
Yes, and delayed care. Misinformation can cause users to delay necessary treatment, worsening their health condition. That is very, very true. If someone's telling you that you're fine and you trust it, you're going to believe them. even though they're not a medical professional.
Exactly.
And last but definitely not least, misleading information. AI can suggest rare alarming conditions for minor symptoms, like literally the flu. Something as big as that. They can say that you have chickenpox. They can say that you have so many things. So a lot of the stuff is like a lot of symptoms like overlap with each other. When it's something like extremely specific that like if you go get your blood drawn, they can like tell like, oh, you're a little bit anemic. Oh, you have low iron.
Yeah.
Yes.
No, definitely. Very scary. You know, it puts ideas into your head. You're like, oh, maybe I do have that. Right. But I mean, I guess it's good to be aware, but I don't know. It can be a little bit much.
And it can make things worse if you're hypochondriac.
I know. I'm like, oh my gosh.
Getting that information reinforced.
No, so then you're just overthinking it. No, like that whole week I was like, oh my God, my eyes.
I'm gonna die.
My eyes. So I guess like wrapping up this show, taking a step back, AI in healthcare can be clearly a very powerful tool. It helps doctors analyze images, identifies patterns in massive data sets, and even helps with things like drug discovery. But as we talked about today, the technology also raises some messy questions. So AI systems can reflect biases in the data they learn from, and they can sometimes produce convincing but incorrect medical information. And if doctors begin relying on these tools too heavily, it might change how medical decisions are made, and there are also broader concerns about privacy and responsibility. So healthcare AI depends on huge amounts of patient data, and it's not always clear who owns this data or who is accountable if these AI systems go wrong.
Yes.
So because of this, policymakers and researchers are starting to explore new regulations to make sure these systems are safe, transparent, and fair. And so ultimately, the question isn't whether AI will be a part of healthcare, because it already is. It already is. The real question is, how do we use it responsibly? And should AI remain just a tool that helps doctors work more efficiently, or will it eventually play a larger role in medical decision-making? So this is all something that researchers, policymakers, and patients are all still kind of trying to figure out.
It's like very up in the air.
No, definitely very up in the air. So thank you for listening to Morning Sign In by Morning Sign Out on UCLA Radio. Yes. We'll see you next time.
See you next time. Remember, if anything's going wrong, consult a medical professional.
Consult a medical professional.
Take what we say with a grain of salt.
Yes, we're a little bit like, we're not like AI.
Yeah, we're not AI.
We're not AI, but take what we say with a grain of salt, and take AI with a grain of salt.
Yes.
Definitely.
Bye.
All right, have a good day.